Thank you for calling CDC Info. My name is Kia. To provide you with resources for your area, may I have your zip code?
Sure, it's 20005.
Thank you so much, sir. And how can I help you?
I was wondering if you can tell me how accurate the COVID-19 tests are.
Okay, I'll be more than happy to assist you with your question. Just to verify, you would like more information on how accurate the CDC COVID-19 tests are, correct?
Yeah.
Okay, now place you on the brief 1 to 2 minute hold while I gather that information.
Okay.
Thank you. Placing you on hold now. Thank you for being so patient with me. May I have 1 to 2 more minutes of your whole time? I'm still researching this.
Okay, sure. Yeah.
Thank you. Okay, thank you for being patient with me, and this is the information that I found.
Okay.
How accurate viral tests are for diagnosing COVID-19 depends on which test was used. Hospitals that performed your test, such as the test site coordinator, your healthcare provider, or health department, to find out what type of COVID-19 diagnostic test was performed on your sample. Now, if you have a positive result from your viral diagnostic test, it's very likely that you have COVID-19. However, it's possible that the test can give a positive result that is wrong, a false positive result. If you have symptoms of COVID-19 but have a negative result on your viral test, it usually means that COVID-19 did not cause your recent illness. However, it's possible for the virus the viral test to give a negative result that is incorrect, a false negative result. In some people with COVID-19, you may test negative if the sample was collected too early in your infection and test positive later during this illness. For information on accuracy of approved diagnostic tests, see the Food and Drug Administration FDA website.
Okay, I called the other day and you guys gave me a totally different answer to that question, but okay, so do you know, see, I've been told with the tests that are given, what they do is they search for any virus within your system, not necessarily COVID-19, but any virus. These tests simply detect the fact that you have a virus. It doesn't detect the fact that you have COVID-19. So you can have a virus and it'll say positive for, they'll tell you that you're positive for COVID-19, but in reality, you're just positive for a virus that is yet to be determined. Is that true, or?
Let's see. It says all COVID-19 tests, including the CDC test, can possibly give wrong results. For example, the test can give false positive results. That means your test results should be negative because you do not have COVID-19, but it comes back positive. Or the test can give false negative results. That means the test results should be positive because you do have COVID-19, but it's come back negative. Sometimes the results are not clear or inconclusive, and the laboratory is unable to tell you if your results are positive or negative. It says incorrect results can occur for many reasons. For example, your specimen may not have been collected correctly, or the laboratory instrument may have malfunctioned. However, such incorrect results should not happen often. Regardless of what your test results are, they should always be reviewed by healthcare professionals. Your healthcare provider will consider the test results together with your symptoms and possible exposure in deciding how to care for you. Now, this is must be what you're talking about. CDC SARS-CoV-2 test has two targets that detect the specific strain of coronavirus. For a CDC diagnostic test to produce a positive result, both targets must be positive. In addition to diagnostic tests for SARS-CoV-2, the virus that causes COVID-19, CDC also has a diagnostic test for other circulating human coronaviruses, not SARS-CoV-2. The test for other circulating human coronaviruses does not produce a positive result for SARS-CoV-2 and cannot be used to diagnose infection with SARS-CoV-2. However, CDC has developed a diagnostic test that will check for A and B type seasonal flu viruses and SARS-CoV-2 at the same time, which will be available soon.
Okay, is the test that you're talking about, is that the same test that people are getting like all over the United States, or is that just CDC's specific test?
It says all COVID-19 tests, including the CDC test.
Okay. And then I guess my other question would be, do you know what the ratio would be of like how many people who test positive, let's say like 1 in 4 or something, who have no symptoms? Do you know what the ratio would be? Like maybe some have symptoms and some don't have symptoms. Is it?
Let's see. I can definitely find out. May I place you on a brief one while I research it?
Yeah, that's fine.
Thank you. Placing you on hold now.
Okay.
presidential candidates square off with Pence.
Our country needs a president who will...
Thank you for being patient with me.
No problem.
CDC Info is a contracted service of CDC and APSCR. We provide general health information in response to common questions from the public and health workers. To answer a more complex and technical question, CDC has a process for your inquiry to be emailed to the CDC experts to respond to your specific question. You will get an email reply. May I take down your email address?
I'm not really interested in getting into all that. I don't really feel comfortable giving out my personal information to a bunch of liars who pretty much. I'm not saying you're a liar. I'm saying that the people who are behind this whole scamdemic, I believe they're liars. But like the reason I was asking is there's a nursing home in North Springs, Iowa, that had 21 residents tested positive on the same day for COVID, and all 21 were asymptomatic. So that concerns me. I don't find that even possible for 21 people to have no symptoms. But another question I have is, you probably won't be able to answer this, but like, why is there no transparency with the those who are sick? You know, every time somebody asks for, okay, who is the person sick? Everybody says, we can't tell you that. Or who is the person who died, supposedly? And everybody says, we can't tell you that because of HIPAA. I understand the HIPAA laws, but like, for instance, when you, let's say there's a motorcycle accident or car accident or whatever, every single day that information is published on the news, like who was involved in the car accident, if somebody died. First they notify the family, then they notify everybody else with their permission. And the same thing is was when soldiers are killed in combat, or when they, especially, you know, if it's something affecting the whole nation, shouldn't there be some transparency in the supposedly long list of all these names?
Well, I can't give my personal opinion for everybody else, but CDC does not have access to, nor does it share personal medical information with members of the public. When CDC receives health data, lab specimens for testing, or survey results, personal information such as name, contact information, and addresses have been removed. CDC uses collected data to show trends, case counts, or percentages of disease exposure or test rates.
Okay, so if I was gonna rant at somebody, I should probably go after like the hospitals and other places that the people who do the tests, ask them for transparency then?
Well, I don't know who you should ask. All I'm, able to do is give you what the CDC gives me.
Oh.
I can give you the number to your public, I can
Like
give
this.
you the number to your state or local health department, and you can contact them.
Okay, well, yeah, I have my state health department. I have their phone number. I might give them a call too after this. But what do you think? Do you think this is all bullcrap? Do you think it's a scamdemic?
Well, I can't give my opinion of any kind.
Oh, okay. Okay, that's all the questions I had. I'll stop wasting your time then. Thank you very much.
No, you're fine. Other than providing the information regarding the accuracy of the COVID test, have I answered all of your questions today?
Yeah, you did a great job of it.
Okay, thank you for calling CDC Info. Please stay on the line at the end of this call to answer short customer service. Have a great day.
All right, thanks.
We
You
would
too.
like to get feedback on your experience with CDC Info.